Hey there, welcome back to the channel. If you enjoy what you're about to see, don't forget to hit that subscribe button and turn on notifications. Your support means a lot. Let's jump right in. Persistent left pelvic pain. I experienced sharp pain on the left side of my pelvis from time to time, which occasionally became intense. Eventually, I went to the ER, where they ran a battery of tests, but none provided any clues about the cause. It wasn't until several months later that I realized the pain was due to ovulation. This made me realize how much more education doctors need about women's health. Dangerous childhood experiment? When I was 8 years old, I became bored and decided to grab a Gatorade bottle from the pantry and a kitchen knife. Over the sink, I began stabbing the bottle to see how easily the knife could pierce its thick plastic. The experiment almost resulted in the loss of my thumb. Hospital visit with my daughter. I took my daughter to the hospital after she had been throwing up for 12 straight hours. The nurse made me feel embarrassed, acting as though I was overreacting for bringing her in. However, my daughter quickly threw up all over the nurse's computer, and we were immediately taken to a room after that. Jumping out of a window. At the age of 10, I wanted to visit my friend's house, but my older sister, who was in charge of babysitting me, refused to let me go. In response, I decided to jump out of my second-floor window. Unsurprisingly, this behavior led to me spending a large portion of my childhood grounded. Shaving mishap and severe infection. One day, while taking a shower, I noticed an ingrown hair caused by shaving my genital area and decided to pop it. A few days later, I experienced severe pain in my testicles and went to a walk-in clinic. Explaining that my testicles were extremely sore and swollen wasn't exactly dignified, but I managed. Upon examining me, the doctor seemed alarmed and confirmed it was a serious infection. He warned me never to pop ingrown hairs, particularly in that area, because if the infection doesn't drain properly, it spreads internally. He prescribed antibiotics and cautioned me that an abscess might form, which would need draining. After a few days of following the prescribed treatment, the pain subsided somewhat, but I discovered an abscess had indeed developed. It looked like raw chicken skin, and I thought I could handle it myself. I removed it, which caused a lot of bleeding, but completely eliminated the pain. Feeling relieved, I started my day with a sense of accomplishment, until I noticed a dime-sized hole in my scrotum. Panic set in as I realized I couldn't wear clothes without risking contamination. I applied a bandage and rushed to the emergency room. Explaining that you have a hole in your scrotum is as undignified as it sounds, but it does get you immediate attention. I was moved ahead of elderly patients in line who glared at me in disapproval as I was taken for an ultrasound. The technician slathered me with gel and began the scan. I joked about expecting twins, but they didn't laugh. Eventually, I was informed that they were checking for gangrene or a flesh-eating infection. Thankfully, none were found. After multiple stern warnings about the dangers of squeezing ingrown hairs, I was told that as long as I continued my medication, I would recover. It ended up being the worst birthday of my life. Friend swallowed a large coin. This didn't happen to me, but I once had to pick up a friend who swallowed a 50-cent coin just to win a $2 bet. For context, the Australian 50-cent coin is quite large. They ended up needing an endoscopy to remove it. The hospital let them keep the coin afterward, though it was blackened and corroded. Fainted after intense bathroom incident. One time at work, I pushed so hard while using the restroom that I fainted when I stood up. I woke up in the hospital with a huge bump on my head and a dislocated collarbone. They had to do a CT scan and prescribe physical therapy, all because I strained too hard in the bathroom. Wife's strange reaction at a pool. My wife passed out on the deck of a public pool. When she regained consciousness, she could barely speak or move. We rushed to the hospital where doctors couldn't figure out what was wrong, even after running blood tests. However, after a few hours in the ER waiting area, she gradually began to recover. At the time, we were staying at a friend's parents' house while they were away. The next day, we discovered she had eaten a cookie from their freezer without realizing it was heavily infused with cannabis. We confirmed it when she ate another cookie later and shared some with me. Flesh-eating bacteria. Scare. I once thought I had flesh-eating bacteria on my legs, but it turned out to be nothing more than razor burn. Locking myself out of the apartment. I regularly lock myself out of my apartment, once or twice a week to be exact. The reception staff must think I'm a total idiot every time they see me and my dog walking in for help. My wife works at the hospital, so I usually end up going there to borrow her keys. Spicy food accident. One time, my private area became swollen and red without any obvious reason. I had a flight the next morning for a wedding and panicked. I asked my girlfriend to take me to the hospital, where the nurse inquired if I had been eating spicy foods. It turned out that I had eaten hot wings and touched myself while using the restroom before washing my hands. The nurse gave me a Benadryl and told me to relax. Later, I requested a copy of the nurse's notes for my records. They were absolutely hilarious. Dog bite. During a fight, when one of my dogs attacked the other, I tried to separate them by sticking my hand into the aggressive dog's mouth. This resulted in 6 stitches in my hand and 2 days off work. Lesson learned: never put your hand inside an angry dog's mouth. Breaking my hip. Getting off the couch. I broke my hip simply standing up from the couch. My hip was already in bad shape due to years of taking a medication that weakened it, and the pain was excruciating. At first, I didn't even realize it had broken. I thought it was just flaring up. Later, it was revealed that the bone had necrotized, releasing a severe infection into my body. I eventually woke up from a medically induced coma a month later, with no memory of how I ended up in the hospital. Edit. Wow, I woke up to so many replies and upvotes. Thanks, everyone. Edit 2. Here's some additional info. 1. Prednisone, a steroid prescribed for my rheumatoid arthritis, caused the damage to my hip. My doctor at the time claimed it was safer than the pain meds I had been using. In hindsight, I strongly disagree with him. 2. My dad called an ambulance for me a few days after the incident, when I passed out from exhaustion. I had been stuck in my desk chair all night because it was the only place I could find any relief. He eventually moved me to the couch, where I managed to sleep for a bit. However, I spiked a fever, prompting him to seek help. I'm doing much better now. Over the years, I've had my hip and a few other joints replaced. While I still deal with pain from rheumatoid arthritis, it's much more manageable than before. My current doctors are far more attentive and listen to my concerns, unlike the one who put me on prednisone and dismissed me with, "Who has the medical degree here?" Yeah, that's what I thought. My pain management doctor has strictly advised me to avoid steroids like prednisone in the future, as they also caused severe bone density loss and other complications. He's fantastic, the complete opposite of my previous doctor. Thanks again for all the comments and upvotes. Kimchi overindulgence. About 24 years ago, I ate nearly an entire quart of Korean kimchi for dinner. It was so spicy and delicious that I couldn't stop myself. That night, I experienced the most intense stomach pain I've ever felt, even worse than when my appendix burst a decade earlier. The pain was so unbearable that I stripped down to my boxer briefs and sat on the front porch, clutching my bloated stomach and writhing in agony. My wife eventually took me to the emergency room, where they administered an IV painkiller and admitted me for 23 hours of observation. As the night went on, the pain gradually eased, and by morning I felt almost back to normal. While preparing for discharge, the day shift replaced the night shift, and some nurses came to check on me, followed by the new attending ER doctor, who happened to be Korean. He entered the room laughing and joking, explaining that I had a case of kimchi-itis, and scolded me, saying that kimchi is meant to be a side dish, not the main course. He was clearly amused, and so were the nurses and my sleep-deprived wife, who stayed by my side all night. They all laughed at my foolishness, and to this day I wonder if that doctor shared my story as one of his funniest ER moments. Childhood pooping avoidance. As a child, I had an aversion to pooping because I never felt clean enough after wiping. It wasn't due to OCD or anything like that. I just didn't like it. So I decided to stop pooping altogether. Whenever I felt the urge, I would hold it in or distract myself by playing until the feeling passed. One night, I woke up unable to breathe. Panicked, I ran into my parents' room, gasping for air until I passed out. They rushed me to the hospital, and I started breathing again on the way there. X-rays and blood tests revealed that my colon was so impacted with stool that it was pressing against my lungs, preventing them from fully expanding, especially after lying down for several hours. The doctors gave me a laxative and required stool samples for a few months for testing. Afterward, I never had the problem again. I learned that poop has to go somewhere, so I had to accept that pooping is part of life. That night was one of the scariest experiences I've ever had. Persistent hiccups. I had hiccups that lasted for 24 hours straight. They finally stopped the moment the doctor walked into the room. Classic. A migraine that saved my life. I had a migraine that caused numbness throughout my body. After undergoing a 3-day evaluation for a stroke, doctors discovered that not only do I suffer from migraines, but I also have an aneurysm. So, oddly enough, migraines ended up saving my life. Husband's false heart attack. My husband once went to the ER in excruciating pain, convinced he was having a heart attack. It turned out to be gas. He just needed to pass wind.